For nearly 100 years, the Visiting Nurses Association has been providing this region with the finest home health care. One of the most well-known VNA services is its hospice program. Carol Kurtz has been the program manager of the VNA Hospice Program since 1998. She has a bachelor's degree in nursing from DePaul University and is a board-certified hospice and palliative care nurse.
I'm very proud of the VNA Hospice Program, and I'm pleased that you've taken the time to learn a little more about how our caring and compassionate staff can help you and your family during this difficult time in your life. Hospice care is offered to people who have an advanced illness, where curative treatment is no longer helping them, and they are looking for supportive treatment to provide comfort at this time in their lives. Most people find that the greatest benefits of hospice is that they can be at home, in their own environment, surrounded by the things that make them comfortable and the people they love. Hospice is a continuation of care, not the end of treatment. Hospice care is provided in a team-oriented approach, guided by and tailored to the patient's unique needs and wishes. The hospice team works together to provide the highest level of care and support, to relieve pain and suffering, while promoting an overall sense of well-being. Members of the team include the patient and family, his personal physician, the hospice medical director, certified nurses and home health aides, social workers, clergy, bereavement counselors, and specially trained hospice volunteers. Other holistic therapies, including pet therapy, may also be incorporated into the hospice plan of care.
Dr. Michael Contreras is medical director of VNA Hospice. He is a board-certified anesthesiologist who completed his training and residency at the Mayo Clinic in Minnesota. Dr. Contreras is part of Rockford Health System's medical staff and is a clinical professor at the University of Illinois College of Medicine, Rockford.
As medical director of VNA Hospice, I work in coordination with your primary physician to help you with whatever symptoms you're having, whether it be pain, air hunger, and we work together as a team. So you still have your regular doctor that is involved in your care, but I also bring some of my expertise to the table to help out with whatever issue, end-of-life issues that are occurring. I think life's a journey, and end of life is part of that journey, and it's something that physicians don't like to think about because we're always geared towards extending life. But I think it's also very important to be able to enjoy the end of life and to not suffer and to have some quality of life.
Hank Herbert was a tool and die maker at Amrock Corporation in Rockford for 39 years. He was an active man who enjoyed traveling, fishing, yard work, and visiting his cottage in Wisconsin. In 2004, at the age of 81, he was diagnosed with Lou Gehrig's disease. As the disease progressed, his family, a loving wife and 2 supportive daughters, were at first resistant to the idea of hospice. His daughter, Chris Alter, had a big fear. She didn't want her dad to know he was getting hospice because she was afraid he'd lose the will to live. As Hank's condition became more serious, his family finally called VNA Hospice. After experiencing the caring and compassion VNA staff, his family embraced the concept of hospice, and today they're extremely grateful for the care and support they received from VNA Hospice.
Well, my husband, he was glad for the care that he got because I wasn't able to do all the things anymore by the time we had hospice, and also for us, and my family, I think it gave us peace of mind.
The most important thing was that he was at home. My dad built the house, and it was the only house that we ever lived in and grew up in, us girls, so it was always very special to us.
This way, if they're home, you're there with them, you can stay right with them and not leave them, and they know that, and I think that's and it makes you feel better, and it makes the patient feel better, everything. I just think it works out really well.
My initial reservation was, Dad's really sick now, and it's hard to accept it and get beyond that, but you work through it, and after the first few days of working with hospice, you feel better. The services they provide, not only my father, but all of us, from medications to bathing to the social worker coming, and if my dad was too sick to talk, he talked to my mother and us. and help us through. There was constant contact. It just made everything so much easier. It takes a lot of the burden off of you, and really your needs are met for everybody in the whole family, mind, body, and spirit. It just is, and it always was, and it was such a wonderful experience, and I wouldn't change anything about it.
Hank Herbert and his family utilized VNA Hospice and Bereavement Services for 16 months. The Herbert story is just one of many that come from family members of VNA Hospice patients. Our hospice staff feels privileged to be allowed to be a supportive part of this meaningful time in their lives. I hope this brief glimpse into VNA Hospice has answered some of your questions about hospice, reduced your fears, and shown you that you and your family can face a life-limiting illness or condition with dignity and control. I encourage you to call the Visiting Nurses Association Hospice Program at 815-971-3765 and find out how hospice can help you. You'll be able to talk with a hospice staff member, learn more about the program, and have your questions answered. For nearly 100 years, the Visiting Nurses Association has been helping residents of the Rock River Valley. Call us today and find out how we can help you, your family, and loved ones.